All right, we're going to go ahead and begin. Welcome, and thank you for joining the Iowa Healthcare Collaborative and the Iowa Department of Public Health for the Iowa Critical Access Hospital Education Series. This is our kickoff and overview webinar. My name is Carrie Seddon. I'm the Community Quality Initiatives Director at the Iowa Healthcare Collaborative. My co-presenter today is Cassie Kennedy from the Bureau of Policy and Workforce Services at the Iowa Department of Public Health. The purpose of the overall educational series is to increase understanding of hospital community health needs, assessment requirements, and really to provide education and best practices to support planning and implementation efforts. Overall, we know this leads to well-developed, meaningful community health needs assessments, which Cassie is going to discuss in greater detail shortly. During the first half of this 30-minute webinar, Cassie will share a summary of the Iowa Critical Access Hospital Community Health Needs Assessment and Survey findings, and we'll discuss how we've developed the education series to specifically address the needs and barriers identified in these findings. I will then follow with sharing details on the upcoming webinars included in the series. We will keep the lines muted during the presentation, so I know there's been chats real quick this morning ensuring that you're muted, and you all are certainly muted, but please use the chat box to submit questions and we'll be sure to address them at the end of the presentation. I saw Kate's chat here. Wow, that recent storm on Monday has impacted quite a few of us. Our internet services and our power for many of us. We've shared a copy of the PowerPoint slides for your future reference if you're impacted and joining by audio only today. All right, so now I'm going to kick it off or pass it off to you, Cassie.
Thank you. So I'll just kind of start out here with an overview of the FLEX program, and I'm sure many of you have seen this sort of graphic before. This webinar series is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services as part of the Medicare Rural Hospital Flexibility Award. The contents in this series are those of the authors and do not necessarily represent the official views of or endorse HRSA, HHS, or the U.S. government. And so this is the overview of the FLEX program. So the FLEX program is composed of 4 different parts, including quality improvement, financial improvement, operational improvement, and population health. And then if we go to the next slide, so the next slide kind of shows that this portion, this webinar series is part of the population health area of the FLEX program. And in this area, Iowa Healthcare Collaborative is providing some population health and community health needs assessment webinars and education. And here at IDPH, we will be providing some individual population health and CHNA support too. All right, and so the purpose of this series, like Carrie said, is to increase understanding about hospital community health needs assessment requirements and processes leading to well-developed, meaningful community health needs assessments. The series material and scope was driven by results from surveys administered by IDPH and IHC and an assessment of available hospital CHNAs. So hospitals completed surveys regarding population health back in November 2019 as a response to a request from me. So thank you if you completed that. That was really insightful and helpful. And IHC also sent out a survey to assess CHNA population health needs. And together, these survey results provided information about specific needs for completing the CHNA process and technical assistance that is needed to ensure a successful CHNA, and the CHNA assessment provided information about hospital compliance with IRS requirements and most frequently identified community health needs. So the next slide kind of shows some key findings from the hospital survey. So we can go to the next slide. So to drive the webinar series, this question provided some insight on what barriers and struggles exist, and we hope to address these issues identified within the webinar series. So the most common barrier identified was related to including input from all community groups and obtaining community engagement. And there are just some other examples there, but really all the feedback kind of fell into these categories. We can go to the next slide. So for the CHNA assessment, this kind of shows a summary of the process I used to assess the CHNAs of the 86 small rural hospitals, which if you're familiar with the SHIP program, I kind of used that criteria, so less than 50 beds and in a rural area. So of those 86 small rural hospitals that were identified, I was able to find 46 CHNAs and 17 health improvement plans from hospital websites. So that was kind of the first step of that, to download all of those that I was able to find. And the second step was to assess the CHNAs for compliance with IRS requirements and obtain information about most frequently cited needs. And to do this, I created a checklist to assess compliance with IRS criteria and reviewed each of the available CHNAs and HITs for compliance. And then after that, I compiled the results and assessed them. And then using that information, like I said, it was in combination with the survey that we kind of developed this webinar series. And so we can go to the next slide here. This kind of shows some of the results from that CHNA assessment. So this is the part of the assessment that looked at compliance with IRS criteria. So you can see some of the categories were a lot more compliant than some of the other ones, such as description of data and other information used in the assessment, and a description of methods collecting and analyzing data. And some of the areas that were less frequently compliant were inclusion of a description of available resources and documentation that the report is adopted by an authorized body of the hospital facility. So overall, it was found that 41% of the CHNAs that were included in the assessment were compliant with all of these requirements. And so that's kind of, that finding there kind of drove the first webinar topic of just providing some information about the IRS criteria and ensuring compliance. And I will mention too that the speaker for the IRS requirements webinar, so the first webinar in the series after this one, Dr. David Palm, the idea for doing an assessment like this of the hospital CHNAs actually came from him. He performed similar assessments on Nebraska's hospital CHNAs, so he's very, very knowledgeable. All right, we can go to the next slide. And so again, this is a summary of that assessment, and this part shows the most frequently identified community health priorities. So probably to no one's surprise, mental health, obesity, and substance use were the top 3 identified community health priorities. And on the next slide, again, summary here of the assessment, and this compares the assessment that I did on the hospital community health needs assessment compared to the county identified health issues. So as part of IDPH's Healthy Iowans initiatives and statewide community health needs assessment, county identified health issues are summarized here on the right side of the table, and hospital findings are on the left side. So you can kind of see similar findings here. And just due to the lower volume of CHNAs in the hospital assessment, broader categories were used here. So you can kind of see it translates to similar categories from the Healthy Iowans assessment, but not identically. So the results appear to be similar, with the biggest difference noticed in tobacco use and vaping. So I found that to be sort of an interesting finding there. And on the next slide here, just kind of a summary of how those findings fit into the webinar series. So in the first webinar, as I kind of said, this hopes to address findings noted in the China assessment to increase compliance with and knowledge about IRS criteria. And then the other two webinars in the series are aimed at addressing the noted barriers for successfully completing the China process and ensuring the China process is smooth from start to finish. And also during the assessment that I did, I kind of pulled out some notes on maybe some best practices or some examples from China. So these webinars, we hope to incorporate some of those into the future webinars. I think that's all I have.
Thank you, Cassie. We're certainly very excited here at IHC to working closely with the Iowa Department of Public Health to build educational content for the education series. So although continuing education is not available for this this overview presentation, we're excited to share it is available for the upcoming webinars that I'll introduce to you. 1 credit hour for each of the 1 hour virtual webinars, so 3 credit hours total if you attend all 3. For more details, please reference page 2 of the Education Series information brochure that you had received in an email this morning. All right, so let's go ahead, as we see here on the slide, let's jump into the first presentation overview. On October 21st, so if you're not registered, be sure to get registered from 11 a.m. to 12 p.m. Are you capturing all IRS general requirements for tax exemption? As Cassie had mentioned, overall, it was found that just about 41% of the Chinas included in assessment were compliant with all of the IRS general requirements. So our intent with this webinar is to ensure you have the information that you need to meet all of the IRS general requirements for tax exemption. So as you can see from the webinar overview and objectives, we'll identify the general requirements that must be met by all nonprofit hospitals. We'll also discuss the strengths and weaknesses and present best practices to overcome these weaknesses. And finally, describe how this process can be used to improve the health of individuals and the overall population. Your moderator for that presentation is Ashley O'Donnell. She's going to present a newly created checklist for conducting, implementing, and documenting the Community Health Needs Assessment. This can be used to help ensure compliance with regulations and as a planning tool as well when designing a process for conducting a community health needs assessment and also your implementation strategy. Ashley is a clinical improvement consultant here at IHC. She's a nurse with her master's degree in clinical leadership and has extensive, varied clinical experience supporting improved health outcomes and healthcare quality improvements. But let's dig in a bit deeper to Dr. Palm, who Cassie had introduced just a few minutes ago. Dr. Palm is an associate professor in the Department of Health Services Research and Administration and director for the Center for Health Policy in the College of Public Health at the University of Nebraska Medical Center. He teaches courses in strategic planning and health policy and has conducted several evaluation projects, including an examination of China's and implementation plans of all of the nonprofit hospitals in Nebraska, again, as Cassie had mentioned. Prior to joining the College of Public Health, he served as the director of the Office of Community and Rural Health in the Department of Health and Human Services, where he worked extensively with rural physician clinics, hospitals, and local health departments. His office has managed several grant projects, including FLEX, the Rural Hospital Flexibility Program, and the Office of Rural Health Grant. He has his education background. He received a bachelor's degree in business administration from Augusta University, a master's degree in economics from the University of Wyoming, and he has his doctorate in economics from the University of Nebraska-Lincoln. So as she'd mentioned, I am certainly excited based on his collective experience. I'm looking forward to learning from Dr. Palm and to improve our overall community health. Okay, let's move on here to our next slide, planning for success. So once a foundation has been established to ensure compliance, now we'd like to support your planning efforts. So on February 10th, at the same time from 11 to 12, join us to learn how to plan for success. So we know a collaborative approach to planning your China can increase the likelihood of successful targeted initiatives and improve China effectiveness. Those expanded community partnerships can strengthen overall community health, along with appropriate application of available tools and resources to streamline those planning activities. As Cassie mentioned, it was identified through the survey feedback that obtaining community engagement was a challenge, along with lack of time and resources. Certainly, as the onset of COVID, I'm sure these challenges are even greater. So we've developed resources to help to support in these needs that are identified. And so we'll certainly ensure that the subject matter expert discusses some adaptive best practices that also can be shared and discussed during this presentation. So during the presentation, you'll learn how to expand engagement, identify how to build those diverse planning teams to elevate and expand the benefits of your collaborative integrated efforts, ultimately to maximize those health outcomes. We'll discuss peer best practice examples to improve community engagement, best practices that have resulted in strengthened services, and we'll also learn how to increase China planning effectiveness, to review community action planning, process improvements to streamline planning to save time and improve effectiveness. A few highlighted process improvements that will provide tips will be to identify needs and prioritize those focus areas, ensure we're setting SMART goals and objectives, defining partner roles and responsibilities, and also aligning performance measures and indicators. I will also be sharing, I'll be the moderator for that presentation. I will also be sharing an example of a community action planning template that can be utilized to organize your planning activities, capturing the process improvements that I've just mentioned. All right, so our speaker highlight for that presentation is Cindy Winters. She's the Population Health Project Manager at the Minneapolis Heart Institute Foundation, and she was the project advisor to the Heart of New Elm project. She takes the lessons learned from the Heart of New Elm project to rural communities working on health improvement initiatives to help accelerate their work. She works with communities to implement evidence-based or evidence-informed initiatives while helping them adopt a policy and systems approach that will sustain healthy lifestyle behaviors over the long term. Cindy assists in creating health as a shared value across diverse community partnerships and helps to build their capacity to assess, to implement and evaluate their health improvement efforts. Prior to joining the Minneapolis Health Institute Foundation, Cindy spent 10 years at the Kansas Department of Health and Environment in the Bureau of Health Promotion, working in a variety of chronic disease prevention programs with a focus on policy, system, and environmental strategies. For those of you that may not be familiar with the New Elm Project, just to provide a bit of background, it was a population health transformation project that occurred over a 10-year period, so from 2009 to 2019. It was focused on reducing the number of heart attacks that occur in that area in Minnesota. To achieve this goal, a multi-sector, multi-pronged approach was deployed across the community, so moving beyond hospital and clinic walls to reduce health risks through physical activity, healthful eating, smoking cessation, and maintaining a healthy weight. So Cassie had previously mentioned when we discussed on a few slides back the most frequent health priorities that were identified in her assessment. The majority of those overlap with the experience Cindy has. So I'm excited to learn from her during that presentation as well. All right. Now that the planning is complete, we move on to the third and final of this education series, Implementing Your Plan, on May 12th, same time, 11 to 12. Continuous evaluation and improvement are essential components when implementing your CHNA strategic plan to improve community health. Applying lean methods, which many of you are very familiar with, but we'll work to apply them specific to this initiative. They can support this process and lead to improvements in performance measure tracking and resource utilization. So this will ultimately help you to save time and allow focused attention on value-add activities that directly impact your community health goals. As those population health improvements are recognized, that's where we come back to that collaborative, transparent communication strategy can heighten awareness, increasing both hospital staff and community engagement. So note here again, aligned with the feedback we received from the surveys, we're looking to support you in increasing both hospital staff and community engagement, and to be as efficient as possible to save time and resources. Leadership engagement is very important in this process, so please share and promote this education series broadly. So during this presentation specifically, as you can see from the objectives there, we're going to apply that lean methodology principle specific to implementing your plan. And we're also going to discuss implementation activity peer best practices, so we can understand various approaches utilizing successful interventions. And finally, this presentation will also address a need to incorporate that communication strategy. Our speaker for the third webinar in this series is Tony Trister. He is our process improvement lead for us at the Iowa Healthcare Collaborative. He has more than a decade of experience in healthcare quality, process improvement, and clinic management. Tony works with clinicians to support clinical and quality improvement initiatives through data analysis and project execution. Prior to joining IHC, Tony managed cardiology clinics at Nebraska Health Institute and worked in value-based healthcare consulting to Nebraska practices. He's completed his graduate work in healthcare operations management, public health, and business administration. Tony has his project management professional certification and serves as a subject matter expert in Lean Six Sigma and project management, holding his Six Sigma black belt from the American Society of Quality. I think you'll enjoy Tony's presentation. He's very passionate and engaging, and we're excited he's able to share his passion and expertise to support improved community health. As we have, it looks like we have about 5 minutes left here in the presentation. I want to let you all know that we will be sending all attendees a link to the recording of your slides of the presentation today. And we also shared the education series brochure with all of registered attendees right before this presentation. A friendly reminder, don't forget to register for the presentations upcoming that we just discussed, but please also share broadly within your organization at all levels to support the need to increase awareness and engagement. Share broadly within your community with your coalition members, your relevant community organizations that you work closely with or would like to work closely with, and of course with your local public health partners to increase and improve clinical community integrated efforts to improve the overall health of your community. We look forward to supporting you along this journey and of course are happy to address any questions you may have. You'll see my contact information as well as Cassie's. Please feel free to contact us with any questions.